Well, good morning, everyone. I think we might make a start now. We've got a few more people coming on, so we'll just let them do that, but we'll make a start and I'll introduce our panellists for today. My name's Kate Wright from the Business Leaders Health and Safety Forum. And look, it's really great. We're really pleased to bring you this webinar today. So we've been working with Shawna, Meister and Bryce Barker since I think around February this year, before the world changed, of course. And they've been really supportive with the forum and helping us to develop some thinking for our members around the upcoming cannabis referendum. So one of the things I've done is helped us with a podcast, which is now on our website and on Spotify, and in the development of the forum's reflective guide for managing cannabis impairment risks at work. And we're really grateful for them to giving up their time for this webinar series, which starts today for an hour, and then we'll have another webinar next Tuesday at the same time. Now, before we get started, just a little bit of housekeeping. If you have questions throughout, please feel free to pop them into the Q&A section. We'll be having a look at them, and if they can be answered as we're going, we will. Otherwise, there'll be a bit of time at the end to go over questions. And also just remembering that this is a two-part webinar, so there will be time, there might be questions that are relevant to next week's session, and Shawna and Bryce will let you know if that's the case as well. We will be looking to finish at 9:30 sharp, which of course for Shawna and Bryce is 5:30 p.m. their time, so we won't be wanting to hold them up too much longer than that. And so really just, this is, as I said, a series, and then in this first part, Shawna and Bryce will be taking us through the preparations to legalise cannabis in Canada, which happened just nearly 2 years ago, and the emerging impacts there, as well as a few other details. So look, I'll hand over to them now. As I said, a few more people coming through. Please pop any questions into the Q&A and we'll monitor them, and hand over to Shawna and Bryce. Thank you.
Thank you, Kate. So good morning, everyone. Bryce and I are both really happy to be here, and we're glad that you could be here to talk with us, or at least to see our presentations. So as Kate mentioned, my colleague Bryce and I, we're going to be talking about what legalization, the Canadian experience of legalization of cannabis, and specifically what that impact was on workplaces, as well as how our workplaces responded and continue to respond now. So as Kate mentioned, it's a two-part webinar, and sorry, I'm just trying to figure out how to advance my slides. It's a two-part webinar, and so today our focus is going to be on providing you first a little bit of context about the legalization, how it occurred here in Canada. We think this is important because it might be different for New Zealand if New Zealand goes this way. And if that's the case, we hope that you can pull out what pieces seem relevant to you from our experience and could be applied in New Zealand and vice versa. The bulk of our presentation is going to focus on the overall putting together of a workplace policy to address impairment. We're going to talk about the various components, and then we're going to spend a little bit of time on talking about some of the challenges our workplaces have faced and some of the ways that they got over them. Our next webinar for next week is we're going to do a deep dive into the specific issues. So we're going to spend some time next week talking about cannabis itself, what are the different types, how they're a little bit of how they're treated differently here in Canada, what you can expect for impairment from cannabis, but we're also going to talk about other impairing factors. So we'll look at alcohol, we'll look at prescription and over-the-counter medications, and we'll also look at the big one, fatigue at the workplace. And then we'll talk about probably the key things that employers ask of us about how to address impairment. We'll spend a little bit of time about talking about how do you observe for it? And when you do observe it, how do you intervene? What's the process? And we'll also talk about return to work. So those are some of the areas that employers ask us the most questions about. And that will be our more detailed look in next week's webinar. A little bit about Bryce and I, where we work. We work for the Canadian Centre on Substance Use and Addiction, CCSA for short. Just going to skip ahead to kind of our focus areas. As an organization, we were created by our federal government through an act of parliament and we are primarily funded by one of our federal agencies, Health Canada. As an organization, however, we are independent, we are nonprofit, and we are nonpartisan, and we create evidence-based information. So we find it important to make sure people understand that we're not a lobby group. We don't have any commercial interests. We don't have any kind of special goal we're trying to make. Our primary goal is that we do produce the evidence. We look at the facts or we conduct the research, and that's what we put forward. So that's meant to just give people the information so that they can use it in a way that's best utilized for them. So at this point of the presentation, I'm going to hand it over to Bryce for a moment.
Okay, thanks so much, Shawna. I'll just share my screen, pick up where Shawna left off. And let's see. So I hope everybody can see my presentation screen now. So as Shawna mentioned, my name is Bryce Barker. I'm a knowledge broker. I'm very happy to be here today to talk to you about this topic. We think it's an important one, important in Canada and important also in New Zealand. Substance use is a part of both Canadian and New Zealand societies and occurs for a number of different reasons. So those can include for recreation, that could be part of medical treatment, or that can be someone with a substance use disorder, so who is using as a part of their substance use disorder. So as a result of the potential for impairment affecting the workplace, we've been approached a number of times by safety-sensitive organizations and groups of employers and other stakeholders about this area. So one of the areas that we highlight, and Shawna mentioned really briefly, was a substance use affecting the workplace policy. So a policy that balances the needs of the employer and the employee. So we highlight that as one of the main things that employers can do to address substance use affecting the workplace, and do so in a way that can positively impact employees, positively impact the organization, and hopefully positively impact society and public safety in general. We wanted to start out with a question for each of you. So who's joining us today? The question was, what type of impairment at work concerns you the most? So the response options that will be coming up are stress, alcohol, lack of sleep, cannabis use, other substance use, mental health, and well-being. So I think that should be coming up right now. So hopefully everyone can see the poll. So what we see, in keeping with other groups that we've spoken to in the past, so mental health and well-being coming out far and above as a first area, and if I'm reading correctly, stress, and then other substances, lack of sleep, cannabis, and then alcohol. So those are very interesting findings given the area that we're concentrating on today. So part of our overall message will be thinking about different types of impairment and different sources of impairment. So it seems like this audience is already right there. So I'll jump back into our slides. Cannabis legalization in Canada took place in October of 2018 in Canada, on October 17th, 2018. At that time, the use of non-medical cannabis was permitted. In October 2019, Canada legalized the use of other classes of cannabis products, including edible cannabis and cannabis extracts. So these substances can be used in different ways and might affect people in the workplace in different ways. So it's an important consideration for workplaces moving forward. So the federal government is responsible for some aspects of importing, exporting, processing, issuing, production. But just one second, getting some messages here. But the provinces and territories are Okay, so I'm being asked to turn off my video, so I'll do that. So, just one moment. Okay, so my video should be off, and hopefully everybody can still hear me. So, sorry, on off video here, some technical difficulties. So the provinces and territories are responsible for the distribution and sales of cannabis. There is some variation among the provinces and territories for how this takes place. We do have an in-depth review of that on our website if you're interested, so you can check that out if you'd like. So there is a planned review of the Cannabis Act in 2021. Which we'll look forward to. That'll be a critical review of the implementation. So hopefully we'll be able to understand some impacts of the Act at that point, and there can be an opportunity to correct any issues with the implementation of the Act. We can speak to, next slide, please, Kate. We can begin to speak in interim of some of the impacts we've seen so far. What we have seen so far is that more people are trying cannabis for the first time following legalization. Those people, the most overrepresented group are 45 years of age and up. The National Cannabis Survey indicated that people are shifting from the illegal market, so they're purchasing within the legal market as opposed to the illegal market. There are ongoing priority areas for education. So these are specifically about lower risk use, so the differences between ingested and inhaled products, the effects of impairment on driving, and the workplace continues to be a priority to address cannabis and to educate the public. So if you could go to the next slide. So what we've seen in the lead up and following cannabis legalization was that there was responses from different employers that varied. So they varied in I guess the extent of the response, and in some cases how conservative employers were being. So understandably, in some cases, some employers were looking at safety sensitive positions like pilots and police officers and really taking the most conservative interpretation of the potential for ongoing impairment after recreational use. As a result, they asked those employees to not use cannabis. They required those employees not to use cannabis within 28 days of a shift. So effectively requiring them to abstain from using cannabis. So there have been other employer responses, the most minimal being that people just haven't changed their substance use policies and have just sort of waited and seen how things played out. That might be more common in non-safety sensitive industries. So people might have had a minimal substance use policy and just left that in place. So there has been this variation. We've also seen some paradoxical situations where people are taking a conservative approach to impairment from cannabis. So even in some cases, medical cannabis. And so rejecting that their employees are affected even by medical cannabis for a medical reason, but then allowing them to use other potentially impairing substances like medical opioids. So there are still some wrinkles that need to be worked out that way. Yet other employers are starting to use this as an opportunity to reflect on what substance use, how substance use is affecting their employees and how substance use disorders are affecting their employees. So we have seen this range of responses. And we've also seen a range of resources developed. So if you could go to the next slide, please, Kate, that'd be great. So we've seen some resources coming out that are attempting to balance human rights, public safety, employer and employee responsibility. So even the Government of Canada has compiled some resources. We've also compiled some resources to share. I believe Kate will have shared them either in advance of the webinar or she'll share them following. But a number of nonprofit organizations have developed resources for employers. The Human Rights Commission of Canada, the Canadian Centre for Occupational Health and Safety, among others, have developed resources to help employers to navigate cannabis legalization and more broadly impairment affecting the workplace. And one of the things that Shawna and I wanted to emphasize was, so we don't have definitive impact at this stage. We have emerging evidence, but the emerging evidence that we do have, what we've seen and what we can say is that we haven't seen major widespread issues. We haven't seen a broad shift in the way that employees use substances like cannabis. We haven't seen high profile cases of people being impaired from cannabis and then putting the public at risk. So we just haven't seen these come through yet. It is possible that, you know, our best sources really to see this would be through coverage in the media and that kind of thing, in the absence of high quality data that's been collected. So we would hope that something like the review of the Cannabis Act and ongoing work by researchers in this area will give us a more complete picture, and the picture might change as we get more data. But so far we can say that we haven't seen major issues. But as I mentioned earlier, so one of the things that employers can do is consider substance use and impairment affecting the workplace more broadly. And, you know, we're encouraged by employers who are starting to think in that direction. So I'll hand it off to Shawna now. So that would be the next slide, Kate. Okay, Shawna, you might be trying to speak and you're still on mute.
All right, thank you. Okay, so just before cannabis was legalized, when it became clear that Canada had made this legislation, we really had an influx of questions at CCSA as well as other organizations about, okay, what are we going to do? How do we handle this? We started having forums with and discussions with workplaces across Canada to kind of get a sense of what they needed from us and also where to go with it and what was already out there. So one of the things we did is we looked at what's the research. So what do we have that's evidence-based that tells us that about workplace and impairment? Unfortunately, there isn't actually a lot of research. There's minimal research in this area on how impairment and substance use affects the workplace. And that's not just in Canada, that's internationally. In the last 4 years since legalization, we do see much more research coming out, but it still hasn't been saturated. There's a lot more room to grow and a lot more areas to learn from. So that was one of the first things we discovered. The other thing we wanted to see was how well prepared Canadian businesses were for the implementation, for the legalization of cannabis. So we looked at approximately 800 organizations to see what their impairment policies covered. Now, this was dependent on the policy being public, and a lot weren't public, which is fair. But out of the 800 organizations, we actually only found about 65 to 70 policies that existed. And out of those, we only found 15 that we would consider a comprehensive policy. And a comprehensive policy would be something that's effective at reducing the impact of impairment. So out of those 800, it's not a very large number. So we were concerned that maybe Canadian employers still needed some opportunities to address the issue. On the positive side, though, a lot of the safety-sensitive organizations already had these kind of policies in place. So there was a recognition within that industry that impairment was a serious risk. One of the key component areas that we saw missing from a lot of policies was review and evaluation. I think there were only 2 policies that we saw that actually had a component that says, let's review and evaluate the policy. Lack of an evaluation can be a little bit critical because if we spend the time and the money to implement a policy, you also want to make sure that it's actually doing what it's supposed to do. So that we saw that most policies weren't undergoing evaluation was also an area we thought would need some improvement. One of the other things that we frequently get approached by with Canadian businesses, and this is more so on the non-safety sensitive side, but is how do we make the business case for creating an impairment workplace policy? Well, how do we convince our management that this is necessary? Now, like I said, a lot of safety sensitive organizations already recognize the risk factor. Non-safety sensitive organizations, we're having a little bit more of a challenge with this. One of the things our organization has done in partnership with another organization in Canada is we're looking at the costs of substance use. And one of the ones we looked at was lost productivity. And so the year 2017, Canada had approximately $20 billion in lost productivity attributable to substance use alone. So $20 billion for our population, which is around 35, 36 million, that's quite a big chunk of our economy went to lost productivity in 1 year. So for some of our organizations, this was also another way to make the business case for addressing impairment. Next slide, please. So what can we say about substance use? There are some aspects that have an impact on substance use, but there are also some organizational structures that can potentially create substance use, so risk factors. I'm going to talk about the impact first, so everything on the left side of the page. Absenteeism is a very common one. It's one that's easy to see if your employee isn't there. It's a little bit more of an impact on your business. One of the things that a lot of employers don't easily see right off the bat is the presenteeism issue, and that goes to productivity. You might have an employee who is impaired for whatever reason, and it's having an impact on the quality of their work, or in the productivity of their work, or in the timeliness of their work. Another area where substance use can have an impact on the organization is employee morale. The people who are most likely to discover that an employee is being affected by a substance use disorder is generally their colleagues. So it's noticed amongst them first, and it might just be a sensitive situation for them to come into work if they know that one of their colleagues might be at risk. We already talked about lost productivity. Substance use doesn't just affect you in terms of physical impairments, it can have an effect on your cognitive abilities as well. Substance use also has a number of impact on the health. Chronic diseases is a very common one. So as an example, alcohol is linked to cancer and liver cirrhosis and diabetes. I think of safety sensitive industries. Most of you are familiar that substance use can create injuries and accidents as well as fatalities. And at least in the Canadian context, there have been a number of legal cases that have centered on substance use and the impairment and the impact on the business. So on the right-hand side of the screen, these are some of the risk factors that a lot of organizations usually find helpful to know about their own business in terms of looking at substance use, as well as actually mental health issues. So one of the first factors that tends to contribute to an employee potentially taking up or being affected by a substance use disorder is whether or not they have access to alcohol and drugs. So industries such as restaurants or bars, or medical industries where there are drugs and prescriptions on site, these groups, this type of industry tends to be at a higher risk for these types of factors. High stress jobs, these tend to also generate or be more likely to generate a substance use issue. And we saw this with the impact of COVID in Canada. In the last couple of months, we've seen an increase in alcohol and cannabis consumption, and that's been a bit concerning for us as well. Duties or types of work that also have a higher risk factor for substance use are repetitive duties or shift work. That's because usually the stage for this is people are looking for something to stimulate them, to keep them alert. So they start off with caffeine, they might move on to an energy drink, and then when those aren't working, they might move on to stimulants, something to keep them awake. So those types of workplace factors can have an impact. Fatigue, same kind of thing. Negative work environment, we often hear about people who like to go out for drinks after work and just let off some steam. That can become a repetitive habit if the work environment is negative for an extended period of time. And another aspect that's related to a potential increase in substance use is meetings with clients that involve alcohol. So we often have, especially more in upper management, we have people who are having those working lunches or treating clients out for dinner after work. And if this happens on a frequent basis, you might see more substance use or people developing habits where drinking becomes part of the social culture of their organization. Next slide, please. Okay, so we will be focusing primarily on cannabis, particularly in the next webinar, but we wanted to just put this into context. There are a lot of factors that can affect somebody's ability to be fit for duty at work. Some of the ones that are often forgotten are things such as prescription and over-the-counter drugs, mental health, fatigue. So cannabis is just one of those issues. And based on the poll we just did, it looks like everyone's well aware of that there are multiple factors that can be having an impact on you. Next slide, please. So for the next part of our presentation, we're going to focus a little bit more on just what should be in a policy, what are the key components, and then some of the issue areas that some of our businesses have faced and either how they've overcome them or some of the recommendations that they have made. Next slide, please. Okay, so although the research on substance use in the workplace is still kind of under development, the most effective policies from our, at least, examination tend to be those that are comprehensive, clear, and that they consult multiple people who could be affected by the policy. And when we did the review, generally speaking, substance use policies should address at least these 8 key areas. So first of all, they should have clear objectives and scope. So that means an employee needs to know what's expected of them. We do see some policies that aren't very clear about where they're crossing the line, and so that creates confusion for the employee. Policies should also consider prevention measures, so education and training of supervisors and managers on how to handle these types of situations. A third component that should be included in policies is being able to observe and investigate for substance use and impairment. And we're going to talk about that more specifically in the next webinar. Another component that should be in an effective workplace policy is something that has some supportive aspects for the employee. So the policy shouldn't be strictly disciplinary. There needs to be a balance between workplace needs and employee needs. Policies should also have a component that speaks to how an employee will return to work or return to duty. And we're going to speak about that more specifically in next week's webinar. Policies also need to explain exactly what is non-compliance. We do see sometimes that a policy says zero tolerance for impairment, or zero tolerance for alcohol, or zero tolerance for drugs, but what does this mean when it comes to the gray areas, like someone who has who's using a prescription, or somebody who's taking cold medications during the flu season, which tend to have some level of impairment with them. So non-compliance does need to be specifically spelled out in a policy. Policies should also undergo regular review and evaluation. We have an example from an employer from the natural gas industry a few years ago who spent a lot of time implementing an impairment and substance use workplace policy. And after the first, I think it was the first year, 2 years after they implemented the policy, they hadn't noticed a drop in what they had hoped would be substance use issues in their workplace. So they conducted an evaluation. They were actually able to determine I think it was 3 key areas where things weren't being implemented the way that they needed to be in order to be effective. So it was a really, so conducting reviews and evaluations can be critical. Once that employer changed these things about their organization, they did start to see a drop. It took a couple of years, but they did see a drop in risks and use of substances. Last thing, policies must meet the legal requirements. I think that's a given. We're not sure what they will be in New Zealand if legalization goes through, but you will more than likely have to have a lawyer involved in the development of your policy. So these are 8 broad areas. There are a lot of subcomponents that can be looked at. So testing, what are you going to educate employees on? What does return to work look like if you have an agreement in place? So this just provides an overall view, and as long as you make sure you're touching on each of these and then start to drive down into the detailed areas you're likely to develop a fairly effective policy. One thing you can do is you can look at other policies. Just make sure that you tailor them to your own needs for your organization. Next slide, please. So if you don't have a policy, or if you have a policy with only some of those components, how do you address substance use? What are some of the lessons we learned from the organizations that we've been working with in Canada? One of the first things we found out, or at least that we feel is a good lesson learned, is describe what fit for duty means to your employees. It has to cover all forms of impairment. One of the things we did see frequently in policies is that they talk about not consuming impairing substances while at work, but a lot of them miss the before work component. So you have employees who could be coming in hungover, or employees who could be coming in tired. So it's really important to make sure that fit for duty is very clear about what that means from the beginning of the workday right through to the end. Another aspect of policies that we see improving over the last few years is to address more than just alcohol and cannabis in the substance use policy. One of the biggest areas, and I've brought this up already, is that we see a lot of policies missing out on talking about, well, how does an employee handle prescriptions or over-the-counter medications that could be impairing them. Really good policies will explain the process for an employee on how to report prescriptions or using over-the-counter medications, how to report that to their human resources or whoever it is in their organization that handles these types of issues, and what kind of processes can be put in place for handling those types of other impairing situations. So make sure you're thinking of more than just alcohol and cannabis. In terms of policies, language matters. We find that people who see the words misuse or abuse or addict, these terms come across as more derogatory for them, and a more neutral term, which is also more inclusive, is to generally just call it substance use. One of the reasons is that a lot of people, whether or not they might be affected by a substance use disorder, might not see themselves as fitting in this category. So if they see a policy that says, impairment or substance abuse, they might begin to disregard it just because they might think it doesn't apply to them. They don't see themselves as somebody who abuses a substance. The other reason why we recommend using the term substance use is because it kind of captures all the types of impairment that could be there. So for instance, you might have somebody who again, took cold medication the night before. They're not somebody who's necessarily affected by a substance use disorder, but they might be coming in impaired. So when a policy is much more inclusive in this matter, it starts to apply to everyone. People start to think about it in terms of, okay, if I've gone out drinking last night, does that affect my work today? Another important aspect is making sure your policy, once you've developed it, that it meets your insurance company requirements. For those organizations that have insurance companies as part of their benefits to their employees, we found that insurance companies can be very particular about the language that's used in parts of your policy, so make sure you're consulting with them. Prevention, education, and training. From our research, the evidence says that this is hands down the most effective way to reduce impairment in the workplace. If you want to prevent it, a really good approach is to make sure the employees are provided education on what substances can do, what impairment can do, what the impact is on their personal life, what the impact is on their workplace, as well as providing training for supervisors and managers on how to handle these types of situations. From the research, this has been one of the aspects of a policy and best practices that has been shown to be incredibly effective in terms of reducing the any type of impairing effect. So there's a lot of information here. If you're wondering how to put this together, you don't do it alone. We recommend that you consult a number of different people, professional people, a medical professional with specialization in addictions, people with lived and living experience, insurance companies, and prevention experts. And I'm going to hand it back over to Bryce.
Okay, just coming off of mute. And so I will share my screen, put it into presentation mode. So I think we should be good. So hopefully everybody can hear me okay. I won't chance it with the video, but you know, as Shawna alluded to a bit, there's an opportunity within organizations to consider prevention, education. So those can be very effective parts of a policy. But the culture of an organization around substance use and impairment can also be very important. Workplace culture can be a large barrier to addressing substance use. So Shawna touched on it briefly when talking about the potential for meetings that involve alcohol. Your culture around a substance like alcohol might be that maybe it's actually worked into the culture. Maybe there's really unclear rules about what occasions people are allowed to be drinking in and around the workplace. It's also the potential that a culture around substances can be very stigmatizing. So one goal for an organization can be to work to reduce stigma and discrimination, especially the perception of stigma and discrimination among employees. So if someone perceives stigma and discrimination within an organization, they might be less likely to come forward and seek support if they need it. They might be less likely to, as Shawna mentioned earlier as well, speak to a colleague and seek informal support. So it might not necessarily help to help get employees what they need. So something that Sean has mentioned a few times and we'll mention a few times before we're finished is there's an important need to balance support measures and disciplinary measures within policy so that an employee feels that they're being encouraged to be proactive and to address substance use, or to, again, there's that clarity around what the lines are. In the Canadian context, we've seen peer-to-peer programs show up as effective, so showing some promise. So this can be another supportive element that's worked into the workplace. So where I have the opportunity to speak to a peer who understands how to get the help I need within my organization, or potentially has had experiences themselves of getting help and being in recovery. So that can be a very helpful presence in a workplace and help take away that, that perception of stigma and discrimination. So in this regard, it's very important to consult with employees, human resources professionals, unions if they're applicable in your setting, and other experts who can help you to really address your organizational culture. And that might be in part through embedding that policy component of prevention and education that Shawna mentioned. So just make sure my slides advance. So this came up very briefly in Shawna's discussion about meeting legal requirements, but it's the employer's responsibility to provide a safe working environment that also balances respect for human rights. So again, that central theme of balancing employer and employee needs. So in Canada, substance dependence is recognized as a disability, and employers have the duty to accommodate an employee who has a disability up to the point of undue hardship. Employees have the duty to inform the employer about all aspects of their disability. So in the case of a substance use disorder, if someone is in recovery and they're relapsing, it is their responsibility to speak with the employer. So as you can imagine, it's of the utmost importance to have a clear understanding of the legal requirements. So again, in a context like New Zealand, speaking with someone who is very familiar with the legal aspects of developing an effective policy in your setting. But then it might also be worthwhile to consult with a human rights expert who can add some other perspective to the policy that you're developing to make sure that it does both meet those legal requirements for a safe working environment and also meet human rights expectations. So to summarize, cannabis is one important source of impairment among many. So again, in the poll, and I was thinking after I stopped sharing my screen, if I biased anybody by responding to get the response option off my screen, I apologize. But for this group, I think this group recognized that cannabis is just one potential impairing substance in the workplace. State of someone's mental health and wellness might be another. Alcohol, medications, prescribed or non-prescribed, stress, lack of sleep. There are many sources of impairment, and it's important, and it's a way to reduce the risk to employees and to organizations to develop a comprehensive policy around impairment, especially different types of impairment. So a policy ideally would balance the needs of the employer and the employee. It would monitor organizational culture to make sure that everything is being addressed effectively, and it would make sure that to evaluate the policy. So to make sure that if you had goals for the policy, you wanted to potentially see a reduction in some key indicators that are related to the policy, then you would want to be able to effectively evaluate those. So I'll just make sure. So we do have a handout that should be provided to you. Again, I'm not sure if Kate already sent it out, but there are some resources there, a range of different types of resources that you can review. They are Canadian resources, but some of the principles would hold in a New Zealand context. We wanted to highlight especially problematic substance use that impacts the workplace. A Canadian group developed this resource in 2012, but the principles are still very relevant and very useful. So Shawna and I are both available if you have follow-up questions that we can't get to in the Q&A. And we've been very happy to speak to you about this topic today, and we're looking forward to your questions. So I'll stop sharing now.
Thank you to you both. We've got a question that's just come in here. A big issue is around drug testing policies. Sorry, it's kind of gone off the screen. Presence of metabolites do not indicate substance abuse or impairment, merely use, which may be having no detrimental effects to a worker. How do you recommend addressing this in policies?
So I'll let Shawna maybe jump in, but I would also maybe just mention very briefly that we were going to talk about this topic a little bit more in depth in our next webinar. But Shawna, is there anything you would want to say right now about that? You are on mute.
Yeah.
You're off. It's perfect.
So in Canada, I'm not sure in New Zealand, but in Canada, testing is really sensitive here. We have a lot of legislation about human rights. We don't do it as much here as, per se, the US, for instance, who does it quite a bit and has a different view on public safety versus human rights. In our organizations that have testing, what I've seen is most organizations have their own specific policy to decide on how they're going to handle the presence of a drug versus the impairing factor. Now, the safety sensitive organizations who policies I've seen, some of them actually have cutoff limits, and they've just said that, so for certain drugs, for instance, opioids or cocaine, or sorry, not opioids, but cocaine, or drawing a blank on some of the other ones, those are zero tolerance for those. So they've said no. For things like cannabis, we haven't seen the ones since legalization, but they might be following our impaired driving laws for presence versus impairment. It's a tough one to answer because every company handles it separately, and they've decided on their own what it means in their own workplace policy. Some will require a suspension, and as you saw in Bryce's, when he talked about earlier, some of what we saw in the news context, so a really good example is our law enforcement agencies. They have some have a 28-day ban from having any presence of any drugs in their system. Some don't. So it's interesting to see that even amongst agencies that are the same, they've created them differently. I really think that that's going to come down to the individual organization. You measure your safety risk and what you feel an impairing factor is. this is a good place to actually get in touch with a medical practitioner who has a specialization in addiction medicine, and particularly someone, if you can, also has occupational health and safety experience. They're going to have a good combination. They're going to know a little bit more about how to handle the presence of something versus the impairing factor. Again, we don't have a straight across the board answer here in Canada.
Thank you for that. And yes, very different probably contexts that we've learnt as well, given Canada's context and New Zealand's context around testing, but really interesting to know. So thanks, Shawna. Thanks, Bryce. If there are any other questions, you feel free to pop them into the Q&A. We'll be on here for a few moments. In the meantime, I will send through those resources that Shawna and Bryce have mentioned today. So I'll send them through later today, so you'll get a copy of them. And of course, the next webinar will be on next Tuesday morning at the same time. And so really, I was just wanting to thank you both, because it's, you know, we really appreciate the time and willingness to share your experience, which is a couple of years ahead if legalisation goes ahead here in New Zealand. And I think what you've really done today, it's been useful, is to put that cannabis debate into context, into the wider impairment context, which is something that as a forum we're really interested in doing. You know, we are not taking a formal position on the referendum itself, but really our priority is to support you as members managing that risk of impairment, and not just one substance. So it looks like you've covered a lot, because we don't have further questions coming in, but just a reminder of that webinar next Tuesday morning at 8:30, and as Shawna has indicated, it's going to be more of a deep dive into cannabis as well. So this has been really helpful to set the scene for people, and as you said, Bryce, I think that poll's quite indicative of how people are thinking of cannabis in the wider impairment context too. So we'll let you all, if there's no further questions, we'll, hang on, we might just have, there's one more, sorry. We do have one question. You mentioned an increase in first-time users with legalisation of cannabis. Has Canada seen a corresponding increase in mental health or social impact? Has the government support increased to address this?
Well, I mean, I would let Shawna jump in. She has more expertise in cannabis than I do, but my impression so far has been that we have seen some concerns about different types of cannabis products, especially since they were legalized last year. Some concerns that people are accidentally taking a different form of cannabis, an edible form of cannabis. There was just a very local story here today of an increase in a children's hospital where children under the age of 18 are showing up in the emergency department because they have taken edible cannabis. So again, there have been some impacts that way. Again, that the extent of that change, we don't know yet in the long term, but remarkable enough that it came up in the media. But I would let Shawna speak a bit more about that.
So, interesting question. One of the risks or one of the challenges with any kind of change in any kind of policy is it takes generally 5 to 10 years just to even see really a true impact on something. The U.S., there are 2 key states, other states, but mainly Colorado and Washington legalized before we did, and even they are still. It's hard to say what the impact is. It takes a little bit of time. I think it's a good question because we are looking at, so we did mention our federal government, in order for them to pass the bill to legalize cannabis, they also had to pass a requirement that it was going to be reviewed in 2021, which is 3 years. That's a very short review time. And I'm working with some of the organizations that are part of that review, and to have that kind of data that quickly is very difficult. What I can say, and we don't have hard research evidence because it's just too soon to say what would happen after that. But we have seen an increase in groups that we didn't necessarily know would happen, but it corresponds to what we saw in the US. So we did see an increase in use by older adults. We did see some previous users who had quit using cannabis go back to using cannabis. In terms of the relation to mental health, and social aspects. I think it's too soon to say, but we have seen, so one of my other jobs is working on impaired driving, and we were looking at some results from a roadside survey of impaired drivers in one of our provinces. And the interesting thing was, cannabis just skyrocketed in one age group. And we were wondering if they were doing what we would call a medical substitution. So instead of taking a prescription, maybe they've decided to take cannabis first to see if that will, alleviate any issues that they're experiencing. It doesn't tell us, like, it's just not enough information. It's just too soon to see what that kind of impact will be. We haven't seen anything drastic in the news, no major implications. It's just, it'll take some time. We've just seen these little blips, though, of these different pieces of information or these different target populations that there have been changes, but we don't know if that's yet going to be across the board, or was it just a one-time thing? So it's too early to say. So far, nothing big has happened.
Thank you both. And yes, it is a very short turnaround time to find data, so quite interesting. Thank you. Right, well, looks like we've got no further questions at this stage. So once again, thank you both very much for your time, and we look forward to seeing you again this time next week.